Welcome to DMV Spotlight on ESPN 630, the sports capital, where we shine a light on stories from the District, Maryland, and Virginia to inform, enlighten, and inspire you. I'm Barbara Britt, and today we're going to be talking about Parkinson's disease. Don't know much about it? We're going to learn together about Parkinson's, and my guest today is Dr. Pritha Ghosh. She's a neurologist, a clinical assistant professor at George Washington University School of Medicine and Health Science. Dr. Ghosh's clinical interest includes Parkinson's, deep brain stimulation, tremor, and other movement disorders. She's an expert in evaluating and treating patients and candidates for DBS, and it was the lead investigator of a study on the use of biomarkers for identifying Parkinson's disease, often referred to as PD, and has been involved in the development of objective measures for Parkinson's symptoms. She also is a volunteer on the medical advisory board for the Parkinson's Foundation in the National Capital Area. And Dr. Ghosh, I want to thank you so very much for joining me today on DMV Spotlight.
It's my pleasure to be here.
Well, thank you, Dr. Ghosh. And of course, we have to start by asking, in this time of coronavirus, Parkinson's patients, before we delve into more about the disease itself, are they more at risk for contracting coronavirus because of having Parkinson's?
Well, Parkinson's disease can affect people of many different ages, but it is more common in people over the age of 65. And, as we know from the guidelines from the CDC and from what we're learning, the coronavirus does affect people over the age of 65, often more severely, and they are at a higher risk for that reason. Parkinson's disease itself does not, as we know it, affect the immune system and make you more likely to contract COVID-19. However, and we don't have a lot of data about this yet, but we do know how Parkinson's patients do with other viral respiratory illnesses. And we know that oftentimes patients with Parkinson's disease, when they get another viral respiratory illness, they often have a more complicated course than, someone else that's the same age and does not have Parkinson's. It can make a lot of their symptoms of Parkinson's worse. Also, they can have more respiratory issues, difficulty breathing and swallowing and that kind of thing. So, if we kind of extrapolate what we know about people with Parkinson's that have other viral illnesses and, people with Parkinson's getting COVID-19, we can assume that they may have a more complicated course, and it's important for them to sort of practice these social distancing and hygiene recommendations that are being implemented across the country.
And that is good counsel. Of course, we're speaking with Dr. Pritha Ghosh. She is a neurologist. And Dr. Ghosh, tell us really what we know about Parkinson's. I know it's complex, and it affects the brain and the body. So help us understand what we know so far about Parkinson's disease.
Sure. So Parkinson's disease is a chronic and progressive neurodegenerative disorder. That means that it is a disorder that affects the nervous system, and it does progress over time. It's actually the second most common neurodegenerative disorder worldwide after Alzheimer's disease, and affects about 1.5% of the global population over the age of 65. So Parkinson's can affect the entire nervous system. One of the things it can affect is parts of the brain, and the part of the brain that gets affected and causes some of the movement symptoms that we see in Parkinson's disease. It's a part of the brain called the basal ganglia, and it sits deep inside the brain, and it's basically responsible for letting our bodies move properly. It's like the command center that says, go ahead and take a step and walk and that kind of thing. And in Parkinson's disease, what happens is that part of the brain doesn't work well enough. Some of the cells in the brain that make a chemical called dopamine stop working. and degenerate. And without dopamine, that motor part of the brain just doesn't work the right way. It's kind of like trying to drive a car without gasoline. The car's not going to move unless you have the gasoline. The brain's not going to be able to tell the body to move unless it has dopamine. And so the cells in the brain that make dopamine degenerate, and that is what's causing some of the movement symptoms of Parkinson's. Things like shaking on one side of the body, or really slow movements, or difficulty walking, or feeling stiff. These are some of the common symptoms that you'll see with Parkinson's. But as you mentioned, it's actually more than just a brain disease. It can affect other parts of the body too. So it can also affect the nerves that go to your gut or control your blood pressure. And so it can have a number of other symptoms as well outside of just these movement symptoms.
It's just such a complex disease, Dr. Ghosh. And do we know anything about how we get Parkinson's, how people contract? Is it a disease that you contract, or is that all part of the discovery process that the Parkinson's Foundation is working on?
Well, so first, the Parkinson's Foundation of the National Capital Area, or PFNCA, is not a research organization. It's an organization that's meant to support the patients and family members affected by Parkinson's disease locally in the D.C., Maryland, and Virginia areas. So they provide things like exercise classes, educational programs, support groups, speech therapy courses, yoga, boxing, all kinds of things to support people with Parkinson's in this area. And they actually have over 300 different classes and seminars and programs every single month in 20 cities across this area. They don't, however, do research specifically. There are national organizations that are not affiliated with our local PFNCA, as they call themselves, Parkinson's Foundation of the National Capital Area. And some of these organizations nationally, these other ones, will support research in Parkinson's. In terms of trying to understand, why a person gets Parkinson's disease, that is something that, we're still trying to understand. As far as we know, about 4 to 10% of people with Parkinson's have a known genetic cause of Parkinson's disease, which means the vast majority of people that get it don't have necessarily a family history of Parkinson's disease. They just get it for some reason. And that may be that they have some predisposition for it, and then something happens environmentally that triggers it. But it is not an infectious disease. It's not something you catch from another person. What we do know is that often in most forms of Parkinson's, there is an accumulation of an abnormal, toxic, probably protein in the brain in certain cells that are causing these cells to not survive. And as I said earlier, the cells that are affected are the nerve cells, some of the nerve cells in the brain and in the body. And it can cause things like not being able to move your body appropriately, or having things like shaking in the body and that kind of thing.
And let me just circle back very quickly to make clear that as of this time, from the Parkinson's Foundation National Capital Area, obviously because of COVID-19 coronavirus, they're not currently holding classes in person. But I'm assuming that as soon as we get the all clear, whenever that may be, that those classes will resume. So I just wanted to make sure that we shared that information.
That's right.
As well. And go ahead. I'm sorry.
I was going to say the Parkinson's Foundation of the National Capital Area has made a remarkable pivot and switched from having in-person exercise and other programs to shifting to an online format. They actually have several, like a list of, 20 different online webinars and video recordings of exercise programs that people can do at home, of, speech programs, yoga, Tai Chi, et cetera, things like that everybody can access it within the safety of their home during this time.
That is fantastic. And the web address is www.p as in Paul, F as in Frank, NCA. So it's the Parkinson's Foundation National Capital Area. www.pfnca.org. And we will have that on our website as well at ESPN 630, so you can get more information. We'll give that again at the end of the program. But that is amazing, so that Parkinson's patients, how important is it for Parkinson's patients to continue to make, it's got to be hard to move your body when your body is not wanting to move.
That's right. And that is why it's incredibly important for people with Parkinson's disease to exercise and to use their bodies. Imagine if the part of your brain that tells you to move is not working properly, you've got to get other parts of the brain to compensate. You've got to get other parts of the brain recruited to help you out and be able to move and do the things you want to do. But in order to do that, you've got to practice. You've got to exercise. You've got to stretch, and you've got to do the things that a person with Parkinson's will learn in these exercise programs and also with their physical therapist, occupational therapist, and speech therapist. You know, I tell my patients, you don't become a concert pianist overnight. You've got to practice every day. And that's true. When you have Parkinson's disease, doing things like walking is no longer automatic. You've got to practice it, and you've got to keep doing it every day. And the other thing about exercise is that, you know, it's good for the mind, as well. And it's good for just, you know, your mood and your well-being. And so it's really, really important to exercise in Parkinson's. And even during this time of coronavirus, we've got to make efforts to stay active as we can safely within the boundaries of our home or with proper social distancing.
And my very, very limited knowledge, and it's extremely limited, but dopamine is one of those chemicals that the brain makes that helps you feel good, kind of like endorphins. Is that right?
That is absolutely right. It's the happy neurochemical, the one that you release if you won $1 million as well. You know, dopamine does a lot of different actions in the body, including elevating your mood. And so exercising, actually, we think that it does have that response of, you know, promoting the release of dopamine, but also it releases certain what we call neurotrophic factors in the brain, things that sort of support your brain cells and help them survive and be strong. So there's that benefit as well to exercise. And one of the great things about the PFNCA is that they have so many different types of exercise classes that are available for free to the entire Parkinson's community here. They have things like seated exercise for people who may have balance problems and are not safe to do standing exercise. They have, you know, things for people that are able to do things like boxing and that sort of thing, yoga and that sort of thing. There's all kinds, a whole range of different programs. And, you know, you can go to their website, www.pfnca.org, to learn more about that.
That is fantastic. And I have to ask you, if as you explained, the dopamine, the neurochemical affects our mood, does that then also put Parkinson's patients more at risk for maybe, depression or just even feeling down, which you understandably might already feel if you have Parkinson's, and that you have to fight through. But at the same time, does that make it that much more difficult?
It absolutely does. And, you know, we know that not only, you know, coping with Parkinson's, as you mentioned, can be difficult. You know, when you're first getting that diagnosis, it can be really jarring, and that's understandable. In addition to that, just the disease process itself can affect parts of the brain that are involved in your mood. And so, it can, make it more likely for you to feel down or depressed. It can also make it more likely for you to feel anxious. And that can, in turn, make it harder for you to function. It's almost like the brain has to multitask. Like if it's spending so much time being worried, it's even harder to focus on some of these things that are now challenging, like, like doing your daily activities and that sort of thing. So it's important to address all these different things so that your brain can focus on the things that you want to do and that you can, maintain your well-being and happiness.
Now, Dr. Ghosh, I know that you have a special focus and interest in deep brain stimulation, DBS. I can't even imagine what that is and how that happens. Can you illuminate that for us?
Sure. So deep brain stimulation is a really remarkable therapy option for some people with Parkinson's disease. It's not something that is for everybody with Parkinson's. About 10 to 20% of patients with Parkinson's are a good candidate for this. Deep brain stimulation is a way to treat some of the symptoms of Parkinson's. It does not cure the disease, but it does make it more easy to move, to control your tremor and that kind of thing. What we do with it is we basically put two electrical wires typically in certain parts of the brain. They're inserted into the brain, and then the wires are threaded under the skin down to a little battery pack that sits in a person's chest. Again, everything is under the skin, and the system will release little electrical pulses within the brain and sort of correct the abnormal rhythm of activity in the brain that happens in Parkinson's disease. It acts almost like a pacemaker for the brain, and it allows the brain to function, the motor circuitry, the motor part of the brain to work better and more evenly through the day.
So is it so it's not a treatment in that you go in and you have it done and then you're done with it. It's actually inserted into the brain and into the body. Is that correct?
That's right. And then your neurologist will, turn on and program the device so that it can release electricity in the way that's optimal for the patient.
And is that something then that is monitored constantly?
So it's something that you will work with your neurologist, basically having follow-up visits until you get, a good level of control. And it's also important to realize that having deep brain stimulation doesn't mean you don't take medicines for Parkinson's anymore. It just means that the medicines and the electricity are working together to give you the best control of your symptoms. Most people with Parkinson's, the medicines will be helpful and maybe the only thing that they need through their life. But some people with Parkinson's will, over time, start to develop an up and down response to the medicine, and it can be more unpredictable how well they respond to it. Those are the patients that you start to think about using DBS, deep brain stimulation, for, because it can improve the response of the body to the medications and give you more even control through the day.
And may I ask, is there a reason, you mentioned that 10 to 20% of people are good candidates. Is there a reason not to have it available to all Parkinson's patients?
Well, it's not necessarily something that will help all patients with Parkinson's. It's typically meant to treat people who have, gotten to the point where, yes, they get a response from the medicines, but now it's at a point where it's less predictable, and that sometimes, their medicine might wear off really quickly, or, if they take the medicine, it's almost like they get too much medicine and they're moving too much, and they kind of are going back and forth between the state of having too much movement and not enough movement in the body. And
I'm
so
sorry, go
those
ahead.
people can have a good response with DBS. Or some people, if they have shaking tremor that isn't responding to the medicine that well, sometimes DBS can help in that setting.
And obviously the medicines themselves are very potent, and do they carry their own side effects, as a lot of medications do?
Yes. So there are several different medicines to treat Parkinson's disease. And, we manage Parkinson's disease just the way, primary care doctors will manage things like high blood pressure or diabetes. Although these medicines are not changing the underlying disease process, they are definitely treating the symptoms and making people feel better and improving their quality of life. It is absolutely possible to have a good quality of life with Parkinson's and to live well with it. And these medicines can help to do that. Now, there are different medicines, and most of these medicines are working on the dopamine system that I mentioned earlier. And each of the different medicines have their own side effects. Probably the most common medicine or the most powerful medicine that we have is something called carbidopa-levodopa. It's a mouthful. But carbidopa-levodopa is literally just dopamine that we're replacing, and it can be really helpful. It's also usually pretty well tolerated. The main side effects that a few people may, a small percentage of the population can experience are things like nausea or lightheadedness, sleepiness, and on rare occasion, it can also kind of enhance things like having hallucinations or having compulsive behaviors, but that is a very uncommon side effect.
And you brought up a good point, because a lot of folks in this area may have seen some TV ads that are sticking in my mind where it was, I think, for some kind of medication for Parkinson's. Yeah. And there was sort of this, it looked like there was an hallucination coming to the person suffering with Parkinson's. And is that an effect of the medicine, or is that an effect of the Parkinson's?
So that's a good question. And the answer to that is that it depends on the person, but it's often both. The disease itself in some people can lead to the development of hallucinations. Sometimes it can be really minor things like a shadow moving out of the corners of your eyes, and it looks like a mouse that went by, but it's not there. And at other times, for other people, it can turn into more formed hallucinations, like a person walking and that kind of thing. There are always visual hallucinations. A person with Parkinson's doesn't hear these visions; they just see them. And sometimes that is just a function of the disease itself, and sometimes it's brought on by the medication. And not everybody with Parkinson's will experience this. It's very different from one person to the other, what they experience.
That has got to be so terrifying for the person with Parkinson's, and then by extension for their family members who love them, who may be trying to take care of them.
Yes, it can be frightening. And I think one of the things that's so important when you have a disorder like this is to be informed about it. Not so that, you have this sense of what if, or, when this happens to me. You don't know exactly how your disease will manifest, but it is important to understand how it could manifest so you can be aware of those symptoms and bring it up with your doctor and treat them accordingly. And one of the ways to learn about it is to, go to trusted sites and organizations where they provide information for family members and patients with Parkinson's disease. And I think the PFNCA does a remarkable job of educating our Parkinson's community and providing resources to them in a way that's understandable and digestible and not frightening.
And one of those resources, Dr. Ghosh, that PFNCA, the Parkinson's Foundation of the National Capital Area, launched just earlier this month is called the Parkinson's Scorecard, that is meant to be a tool to help people review the progress that they're making in the fight against Parkinson's. That's got to be another way to frame that, and it has got to be empowering to people who are battling this disease.
That's right. What I really love about the Parkinson's Foundation of the National Capital Area is that not only do they provide support for patients in the area, but they have this very positive outlook, to try to take control of what you can in this disease. And they give you tools for doing that. And the scorecard is one way that people can, look at themselves and say, am I doing everything I can to fight this disease? So essentially the scorecard is basically this online card that the Parkinson's Foundation of the National Capital Area provides. And it has 10 questions or statements that says things like, I understand the importance of exercising regularly, or I understand the medicines I'm taking and I'm comfortable with them. And it has you check off these boxes if you feel that, you understand those things, and you get a score at the end of it, and you can see, where is it that you are lacking an understanding of something, or that, where can you sort of direct your efforts to improve your understanding and fight against this disease. And, it's a way for people to sort of access what they can do to really fight this disease.
And Dr. Ghosh, I know that one of the important things is, of course, identifying Parkinson's, PD, obviously, like any disease, as early as possible. And I know that you've been one of the lead investigators on a study on the use of biomarkers for identifying PD. And I couldn't even tell you what a biomarker is, but I'm hoping you can.
Yeah. So a biomarker is basically some way that that doctors and patients can mark the disease, know that a person has it, or follow how it progresses. So, for example, if you have symptoms of strep throat, you can go in and have a throat culture, and you have a test that says, yes, you have strep throat. And that is a marker of the disease, of that illness, and, that's how you can diagnose it. In Parkinson's disease, we don't have markers to diagnose the disease, not that way, not objective markers like that. We don't have a blood test. We don't have an MRI that diagnoses Parkinson's. It is a clinical diagnosis based on, the symptoms and the pattern that the doctor is seeing. We also don't have good ways to track the disease, to see how it's progressing and say, this much of the brain is affected, or to be able to prognosticate how things might go for one person or another. So there are efforts all across the world trying to find different biomarkers of the disease. The study I was involved in at the NIH is still ongoing and is a biomarkers initiative based primarily on imaging, looking at different types of MRIs and other studies to try to find patterns of the disease that we see on images. There are other ones like that. For example, the Michael J. Fox Foundation has a study that they have across many different sites in this country, looking at not just imaging biomarkers, but also spinal fluid studies and blood tests and that kind of thing. As of yet, we don't have clear biomarkers for Parkinson's disease. We do rely heavily on a neurologist, and specifically a movement disorders neurologist, clinical impression, but that is something we're working on.
And I'm just so glad that you are part of that effort, Dr. Pritha Ghosh. And I want to also mention that the PFNCA Symposium is going to be held online as a conference on April 18th, and that you're going to be one of the co-chairs. In just the last few moments that we have today, Dr. Ghosh, let's just review that we have the ability to, you all have the ability to provide resources through the Parkinson's Foundation of the National Capital Area through the website at www.pfnca.org.
That's correct. And all the information for this wonderful annual symposium is posted on their website, www.pfnca.org. And the annual symposium is something we have done every year for the last 15 years in person. This year, we will be moving it to a completely online format that will be released to those registered for it on April 18th. The videos of all of the talks from all of the doctors in this area will be available to online for a week after that date, and you can view them at your leisure. We will be covering a number of topics related to people with Parkinson's and their caregivers and loved ones. We will also include some information about managing Parkinson's in the era of COVID-19 and how to cope with it, how to do telemedicine visits with your doctor and that kind of thing, but as well as some general topics about Parkinson's, the importance of exercise, medications for Parkinson's, learning about why you might have gotten Parkinson's or what you can do to fight this disease. So I encourage everybody to check out the website, www.pfnca.org, to learn about the annual symposium and all the other resources that this organization can provide.
I want to thank you, Dr. Pritha Ghosh, and she is a volunteer with the Parkinson's Foundation National Capital Area, and of course a doctor at George Washington University School of Medicine and Health. And thank you so much for joining me today on DMV Spotlight on ESPN 630.